Hi, everyone. I'm Mandy Sankulla, your Director of Programs or Partnerships and Communications. And it's my pleasure to be here today introducing Mike Sanchez, who has been so kind to offer his expertise in Medicare. And he is a Medicare broker and also a Mended Hearts member and chapter officer. And I'm going to turn it over to Mike now. If I could just remind everyone to keep yourselves in mute. And there will be plenty of time at the end to ask Mike any questions. So Mike, go ahead.
Hello, everybody. Very nice to meet you. My name is Mike Sanchez, and like Mandy said, I am a Mended Heart member. I just want to give you a little background on that. I had heart surgery. I had a cabbage 5 about 6 years ago. And that's where I met my Mended family, my Mended Heart family. There was 3 angels that came to my room. Unfortunately, they were so booked at the hospital. I had to wait 5 days before my surgery and then 5 days after my surgery. And they were in my room literally every day. That by the end of a couple of days, I was like, who are these people in the red vest that keep coming in here to visit me? Well, they actually played a really big part of my recovery. So that's why I became a volunteer for Men at Hearts, because they really helped me understand that everything was going to be okay before my surgery and that recovery was going to take time, but that everything was going to be okay. So that's why I decided to go ahead and volunteer at the hospital and volunteer with Men at Hearts. And it's been almost 6 years. I love it. The greatest thing is visiting the patients. I love to do that because I remember how they put me at ease at that time, and I try to do the same for my patients that I visit. So I'll go ahead. With that said, I'm going to go ahead and get into this presentation. I'll go ahead and let you know that I broke it up in 2 parts. The first part is just to cover the basics about Medicare, how it works. And the second part is going to fill in a little more of the gaps in between the slides. So that way, hopefully it'll give you the whole picture of the Medicare system. It's very difficult. It's very complicated because unfortunately it can change literally. There are some great changes for 2025, which we'll cover in the slide. But if we can hold all the questions till the end of the slides, because I think after the second part, pretty much mostly all the questions would be answered. If not, feel free. I have plenty of time after the slideshow to go over any questions you have. If we can keep the questions to the topic of Medicare 101, if there's still any questions you still don't have or didn't understand, I'm more than happy to cover that. Because of HIPAA laws, just through if we're volunteers through Men at Hearts, we've got to be careful covering people's conditions. So the questions can only be referring to the Medicare 101 slideshow that I did. That's why my name is there, my phone number is there, and I also have my email. So if you prefer to call, please feel free to give me a call. If you prefer to text, feel free to text me. Or if email is your thing, feel free to email me. But any personal questions regarding you and your health and what's the best choice for you can be done through these phone calls or texts or email. This is all free information. You're not obligated. I am more than happy to answer any questions you have. So get in contact with me. If you decide, hey, Mike's a great guy, I want to go ahead and do business with him, that's great. But if not, just take the knowledge that I give you, and I'm more than happy to take the time to take those questions from you after the slideshow. So with that said, let's go ahead and get into the slideshow, and we'll go from there. So the first one is things you should know about original Medicare. So let me just touch on that really quick. There's original Medicare, and then there's Medicare Advantage. So 2 separate entities, and I'll cover that with you right now. The first thing is a lot of people don't even know you should start looking at age 64 because you can technically start your application 3 months before your birth month. So 3 months before your birth month, if you do that, then you can start on your birth month, day one. If not, you can do it on your birth month and or 3 months after that. The only thing is, let's say you're born in March and you decide to do it in March, it won't be in effect until April. So you kind of skip a month where you could have already been on your Medicare. Um, Original Medicare is the best because it's the federal government, right? We'll just talk about this. 96% of all medical groups, hospitals, will accept Medicare. I'm going to touch on that just a little bit because when you go into Medicare Advantage, it's now private. They're private companies. They're no longer the federal program. They'll offer you everything that Original Medicare offers, but now they're private companies. So what happens with private companies? They slow down on making payments. Things get lost, employees, so on and so forth. So believe me, these medical groups and hospitals would prefer and deal with Original Medicare. But again, you've got companies that have no issues, no problems, and then you do have other ones that do. The biggest thing about Original Medicare is the freedom of choice. So I'll give you an example, me, if and when I get to Medicare to my 65 years, I'm going to go with Original Medicare because I had open heart surgery and I want to make sure that I can go to any hospital, any doctor across the country to find the specialists that are the best at I'm going to need and have that choice. So that's why I would do this. My wife, on the other hand, she is healthy as can be. She takes no medication. She has no health issues. So she'll be a perfect fit for the Medicare Advantage. And that's kind of how you decide, what do I want? When people take your freedom of choice away, you kind of are limited to what they're offering. And that's kind of where you start saying, okay, I get where I'm going with this. So again, when you have the freedom of choice, you can go to, again, any doctor, any specialist, hospital, medical groups. We're talking about the top echelon, Cedars-Sinai, um, the Mayo Clinic, all the UC school hospitals. Those are the best of the best out there. When you go to some of these Advantage plans, you do not have those options. You can only stay within their network, and their network is within your county. So again, there's another way you can decide, okay, well, do I want that or do I want my freedom of choice? So now you start kind of dissecting it. With Original Medicare, no referrals needed. You can call the doctors originally, the hospitals, the specialists, whoever it is, and call them directly. Say, hey, I've got Original Medicare. I want to make an appointment, and you set an appointment. You look at your Advantage plans. Now you have to get referrals. And we're going to go into a little more of that, but I'm just kind of doing that comparison right now so you can start seeing it. You got to do referrals if you're an HMO. You do have PPO options on those programs that give you more freedom, but you still need to get it approved to make sure that they're within your area. So keep that in mind. The biggest thing is no referrals needed. I don't know if you guys are 60-minute people or 48 hours or any of these programs out there, and you'll see some people saying, hey, I've been waiting 6 months to get a referral approval, or I couldn't get this referral approval because it's experimental drugs, something like that. So there are options that are taken away from you when you go to these Advantage plans. So again, no referral needed, freedom of choice. And again, this is across the country. So someone who would want to stay on Original Medicare, I'll give you an example. My sister and my brother-in-law travel everywhere throughout the country. They do motorcycles during the summer and they do their big RV during the winter, and they travel everywhere. You would want to do something with Original Medicare because you don't have to worry. The only time you can go outside of your network and use any medical facilities is if it's an emergency. But with Original Medicare, you can go anywhere you want throughout the country. So again, there it is, the freedom of choice. One of the biggest things about Medicare, a lot of people think that it covers long-term care, and Medicare does not cover long-term care. So please keep that in mind. So talk about keeping the original Medicare. Original Medicare is Part A and B. Okay, and just real simple. Part A is your hospitals, your nursing skills, your home health care if you need help at home after surgery, hospice when it comes to that. And that is what Part A is. Here's what it is with Part A. There's no premium. The reason there is no premium is because if you've worked for 10 years or more, you automatically qualify for Part A at no premium because those taxes that you pay every paycheck, original Medicare is part of those taxes. So that's why you're entitled to it with no premium. One of the other things about Part A is there is a deductible of $1,632 that you're um, entitled to pay. So you're probably saying, okay, 1,632, that's great. The only problem is it's only good for that 60-day period. So if you're hospitalized for, let's say you broke your leg, now you're hospitalized and you stay there for a week or two, you get surgery, you're out, everything's good. Let's say 3 months later, now you have heart complications. You go back to the hospital. You now have to pay another $1,632 deductible. So it can actually be $1,632 every 3 months. So like up to like 4 times a year. If you only get hospitalized once, you're fine. If you get hospitalized for something and you have to go back within those 60 days for the same thing, it's still under the same deductible. So again, not to scare you, but just so you know, you will have that deductible of $1,632, and it can multiply to 2 times or 3 times or up to 4 times within a year period. And the other thing is it's an 80/20 copay. So it's again, it's like most medical insurance when we were working, right? We all had our medical insurance and you would have an 80/20 copay. So Part B now you're also is part of the original Medicare, and that covers anything with your doctors and your specialists. Um, there is a premium on your Medicare Part D, and there's no way to get around it. It's $174.50 right now this year. And again, even if you go to the Advantage plan, you still need to pay that $174.50. Um, there is a deductible of $240 for the year, and that's a one-time deductible. And then after that, you'll be paying the 80/20 co-insurance. Here's the biggest problem with the original Medicare is there is no cap. So what I mean by that is, let's say that you go into surgery and you had $100,000 procedure. So now your the hospital Medicare is going to pay 80%. So they're going to pay 80,000, and you're going to pay 20,000 of that. There's no cap. Let's go worst case scenario, that happens, and 6 months later you're hospitalized again and you have another procedure for $100,000. Well, they're going to pay the 80,000, but you're going to pay another 20,000. So now you're talking about 40,000. So keep that in mind where you're keeping original Medicare. There is no cap. And again, just to reiterate, Medicare does not cover long-term care. So the next thing to know is there are medical supplements insurance. Okay. And this is where it gets a little confusing because there's so many names for so many things. So for Medicare supplement insurance, better known as Medigap. So when you hear Medigap, they're referring to this medical supplement. And what it is, it's a private insurance that's going to cover all of those expenses that we just talked about through original Medicare, the Part A and the Part B. So that deductible, that $1,632 covered through this insurance. Your 20% that you have to pay covered by this insurance. So if you're going to keep original Medicare, you definitely want to get this Medigap insurance or Medicare supplement, which is the same. Again, it's a private insurance. So keep that in mind. If you're going to do this, you definitely want to keep the Medigap. So again, it'll fill in everything except the Part B premium. Your Part B premium, you will always have to pay that, the $174.50. Besides that, everything else is covered through this Medigap insurance. Depending on what state you're in, like here in California, your average is about $150 to $250 a month is what your premium for this Medigap. On top of that, keep in mind you're keeping your Part B premium of the 174.50. Again, the average. Now I've seen in other states it can go as low as $100 a month. I'm giving you averages. The reason I put that 250, I just signed up a lady who did not retire at 65. She went on to retire at 70 just within the last couple of months. And again, if she would have retired at 65, her premium probably would have been about $150. But within those 5 years of her staying employed, those 5 extra years raised her premium to $250 a month. Can it be a little more? Sure, depending on your age, where you're at, but that is your average, 150 to 250. So you're probably, and I've already lost you guys, right? Because those people say, man, I am on a tight budget. I do not have an extra 150 to $200 to pay for Medigap insurance. So then, guys, problem solved. Now you know you want to go to this Medicare Advantage. But the other 50% that I kept, you definitely want to do this Medigap insurance. So again, you have 174.50 for your Part B, and if you get this Medigap insurance, which again, it's optional, you don't have to get it. It's $150 on average for that payment. So those are your two payments you're looking if you keep Medigap. I'm sorry, original Medicare. All right, we'll keep adding on to it, guys, because Part D, you must have Part D insurance for your prescription. So Part D is your prescription. The good thing is the average premium on your Part D is about $25. Depending on what kind of medication you're taking, it could be about $50 a month. So keep that in mind. Now you're looking at the 174.50. You're looking at the 150 plus, let's just say $50. I did the numbers right below. So you're looking at about 3,900 a year if you do the Medigap insurance, and your premium would be about 325, including your Medigap, your deductible for Part B, and $50 for your Part D. So $375. Hey, I've lost half of you guys. You're like, man, I cannot pay $375. Then it's a simple choice. Go with your Medicare Advantage programs, because they do offer a lot of good things. Absolutely. But you lose your freedom of choice. You actually lose original Medicare. The original Medicare is a federal program. When you go to these Medicare Advantage programs, you actually are now signing up with a company who guarantees they're going to cover the same thing as original Medicare, but now you are paying a private insurance. So I'm going to kind of show you how they start making their money. And if you do the math, what you're going to pay these $375 on total premium for if you stay with original Medicare, and you look at what the total that you end up paying on these Advantage plans, it almost balances out, because what you're doing is paying a monthly premium here versus paying $10 for a doctor visit, paying all these other things if you go to the Advantage plan, which we'll go into next. The great thing about Part D, guys, the best thing about Part D is there's a max out of pocket now of $2,000 a year. That is huge. That is a game changer. And I'm going to explain that to you, because our biggest job as agents was trying to make sure that all your medication was covered, and they're all within your formulary, and how much were you gonna have to pay, because each company has their different formularies on what's covered and what's not covered. Because these uh, Part D deductibles in the past, 2024, this year, 2024, and the past, I mean, you're talking about your max out of pocket was 5,000, 8,000, and more. So now your max out of pocket doesn't matter what prescriptions you're taking. $2,000 is the max you have to pay. And here's a little nugget for you. I'm going to give you an example. You know how they brought down the insulin down to $35? Before, I'll give you an example. My mother-in-law would have to pay for her insulin. Before it was like $85 uh, per bottle, and now it's $35 per bottle. So with that $35 premium that she's paying on her um, insulin, the actual price on that is about $150. So they're not going to use the $35 you're paying towards that $2,000 a year. They're actually going to use the $150, the full price of that medication, to get to that $2,000. So you are coming out way ahead, guys. Believe me, it is the best thing to slice bread, this new max out of pocket 2000. So where people were always scrambling, oh my God, what's my medication going to cost? Guys, believe me, 2000, you're golden. So understand that is the biggest thing about Medicare Part D. It has made it so much easier for everybody. Unfortunately, I'll tell you in the future, whether it's next year or the following year, because of this, I mean, you're talking about companies losing 2,000, 3,000, $5,000 that they would normally collect times millions of people. There will be an effect probably next year, if not the previous year, of premiums going up on the plans. So just keep that in mind. But as of right now, we won't worry about that. Choosing Part C. And again, this is where it really gets confusing, guys. So again, that was original Medicare. I told you the pros and cons and how you can get around um, having to pay any major out of pockets with that by going with the Medigap insurance. This is your other choice, okay, which is Part C. And this is where it really gets complicated because Part C is actually called Medicare Advantage, or MA, which stands for Medicare Advantage. Or it's actually Medicare Advantage Part D, or prescription drugs, which is MAPD. So all these names are just thrown at you, and I know when I was getting my license, I was like, man, how do you keep track of this? So this is the confusing part because you have all these different names and abbreviations that you need to try to cipher through, and it's confusing. Believe me, it was confusing for me. So just keep that in mind. So again, Medicare Advantage prescription drugs, or MAPD. This is all private insurance, like I said. Um, you're giving up your original Medicare. Keep that in mind. And again, if you don't have the choice because you don't have the premium money to make that Medigap payment, then go with this. It's not a bad thing, and we're going to cover on it. You have two options. You can go into an HMO. When you go into the HMO, you do need your referrals, which is what I was talking about. And you do need to stay within the network. And again, there is no premiums for these right now. I said maybe next year there will be, whether it's $25, $50, we don't know. But I will prepare you that there will be a premium starting next year because they're going to have to cover that money they lost through um, the max out of pocket on the prescription drugs. So here is the difference, okay? When you go to this HMO, you're going to have a max out of pocket on average of $1,000 to $2,500. Okay, that's your average, guys. Now, good news, there are some plans out there that'll charge you 199 max out of pocket. Those are the best. Your average is 1,000 to 2,500. I just did a quote for a client who I was sitting with and was telling me his mom lives in Philly and that she didn't have transportation because I was explaining that his program he has a free transportation. And he was telling me, I would love my mom to have that. I said, well, let me have her zip code and let me look it up for him. And yeah, we can get her the free transportation, but their max out of pocket in Philadelphia minimum was $5,000. So again, your max out of pocket, kind of what we were talking about, your original Medicare, can go anywhere from $200 to $8,000. So that's where you've got to have someone working for you to find out those programs that have the lower max out of pocket. And on average, it's 1,000 to 2,500. So if you divide this into 12 months, it's very close to that 150 you're going to be paying for the Medigap insurance. So just keep that in mind. Let's talk about the PPO. You get a little more freedom with your PPO, but you still need to have approvals to make sure it's within your group. So now on your PPOs, you already have uh, your premiums. So your average premium is anywhere between $25 to $50 for going to the PPO. And then your max out of pocket grows because now you're dealing with doctors and hospitals outside of your network, and your average max out of pocket is anywhere between $3,500 to $8,000. So you divide that into the 12 months, you are at the Medigap insurance. So you're almost better off going and staying with original Medicare if you decide to go with the PPO plan. So keep that in mind. Here's the great thing about this, and this is where it separates these Part C or Medigap, or I'm sorry, Part C or Medicare Advantage programs, is not only do they offer you everything that A and B offers you, but here's the biggest difference. Your Part D prescriptions that we talked about, the average premium on that, I said about 25 to 50. With these Part C programs, most of them have no premiums on your Part D. So there you save $25. They also include dental. They also include vision, and they include hearing. Over the counter, I'm sure you've heard a lot of this on these TV commercials, but over the counter is money to you. They're going to say, I'm going to give you $50. I'm going to give you $85. I'm going to give you $100. And over the counter, meaning Tylenol, aspirin, cough drops, anything that you need medically can be used for this over the counter money. And this is how these plans bring you in to choose them, because all of them offer the dental, the vision, and hearing, but who's giving you the most on over the counter? And there's a lot more, believe me. I'll give you some. They have transportation, which I covered. And if you're getting older and you need transportation, it's part of your coverage. It covers medical alerts where, the push the button, I've fallen and I can't get up. Some of those you do need a doctor prescription for that, but you can get that. Some of them give you these watches, right, to keep your steps counted. Some of them give you gym memberships. There's a ton of stuff out there right now that these companies are offering, and that's why it's important to go to an independent agent or independent broker that works with. I work with over 15 companies that offer these different programs, and I go in there and find out what your needs are, and then find the best thing for you. Let me give you a little example of that. Your needs, for example, if you need dental work, or if you have dentures, there's some that give you, on average, your dentals is about 1,000 to 1,500. There's some plans out there that give you up to $4,000 in dental. So if your niche or what your needs are dental, I'm going to put you on a plan that gives you the higher dental. If you need visions, there's some people that give you the 300 for every year, or there's programs out there that give it to you for every 2 years. So it's either every year or every 2 years. So if you need glasses every year because you're getting your eyes worked on and your vision keeps changing, then you probably want to go with one who's going to give you the $300 every year, not every 2 years. Hearing, there's some plans out there that can give you anywhere between $300 to $700, and there's some that'll give you up to $1,500. So if you need hearing aids, then that's what I'm going to focus on. So it's what you need is what is the biggest difference on how to choose these programs. Guys, there's thousands of these programs out there. I'm going to give you an example. There's a company that the average company, ABC company, has 4 plans. There's some that have 16 plans. The same company, but they have 16 different plans. So believe me, this is where it gets complicated. And someone like me or any broker that's out there or any individual agent, independent agent, Ask them, how many of these companies are you signed up with? If they tell you more than 10, good. Then they're giving you a good choice out there. So just keep that in mind. Um, there is some expenses. So here's where they start making their money versus that $150 for original Medicare. We talked about the max out of pocket, but they have copays, they have co-insurance, and again, don't forget the premium of the $174 every month. And then your max out of pocket on average can run all the way up to $8,000. So keep that in mind when you're doing your calculations. Um, so options, right? I was just kind of touching on a little bit. Medicare services are all the same. So let me explain that to you. If you go with uh, Z company with Medicare Advantage, or if you go with Y company with Medicare Advantage, it is all the same. Every single company. So I cannot mention company names because of logistics, but these TV commercials, the big companies, right? Um, the one with starts with the U, I'm sure you all know it's blue and it starts with the U. I'll let you guys fill in the blank. The H, the big H, that's green, right? And then the BS, right? It has a shield. Um, so these big companies that are on the commercials every single day, every single morning, evening, they're on. They're great companies. I can write every one of them. I'm signed up to write up with every single one of them. They're great companies. But when you call them direct, they're agents that work for them. That's all they can do. If they work for the U company, they can only sell you those products. If they work for the H company, they can only sell you their products. And if you work for the BS company, they can only sell you their product. So where's your choices? Where's the maximum out of what you need coming from? So that's why it's important. When you call these third party companies where they're saying like, oh, we're as easy as 1, 2, 3, just give us a call. Those third party companies sell their leads to companies, to agents. So keep that in mind. All you're doing is passing your information on to somebody else. And how qualified are they? Do they really care, or do they just want to sign you up? And that's the biggest thing. You want to be able to sign up with someone who cares about what your needs are. And that's why you want to do an independent agent and broker. We have to do everything, get licensed through the state. We need to get licensed. We need to take AHIP um, state tests. We need to take tests for each one of these companies. So all those 15 plus companies that I'm signing, I had to take their training for every single one of them. So this is what I do to make sure that when I service you, I'm giving you the best option for what you need. And most independent agents or brokers will do that for you, because when you call the big companies, they're only giving you options of what their company offers. And if you go to these third party marketing companies that say they're as easy as 1, 2, 3, they're just selling their leads off to other companies or individuals like me. Thank God I don't need them. But people like me, I can just say, hey, I want to buy 10 of them and they'll give it to us. So again, keep that in mind. It's finding someone who's going to do what's important to you, find your needs and get you what you need. And just the last thing, just know some of these companies give us bonuses. They give us incentives to say, hey, send us your business. We're going to give you this and this if you send us 10 contracts. So again, personally, I don't really care. It's more where is the best policy for my client is where where I'm going to put you. So keep that in mind. So again, look for independent agents. There's different companies also, medium-sized companies. A lot of these medium-sized companies are very, very popular, especially in the independent states. Here in California, there's about 4 of them. And these companies were started by frustrated uh, individuals. There was this group of 13 individuals that were just frustrated with not knowing and understanding Medicare, that they went and got educated and started businesses. So these companies are very focused on helping individuals because they were tired of not being given the right products that were their needs. So these middle-sized companies, like I said, in California, there's at least 4 really big companies that are great companies that give customer service not only to their clients, to the doctor's offices, and to us, the independent agents, where we can call them and get a phone call answered in less than 5 minutes. Where if you call these bigger companies, I swear I've been on hold for over an hour with these bigger companies just trying to get information that I need from them. So this is where these middle-sized companies really come through for everybody. Um, and then you've got some new companies. And these new companies are set up the same way. These companies are set up because now these middle-sized companies are getting so big that now they're picking up the slack where they're saying, hey, we're going to offer you better service. And they do, believe me, they're great companies out there. I'll give you an example. Very recently, this past year, they started this food subsidy program that can give you anywhere between 70, 100, $130 in food subsidy. And it was one of these smaller companies that allowed them to come into our realm of business to allow that. And now everybody's offering them. So good thing for these smaller companies that allowed that to come into our Medicare system so that people have that extra money. So it's great to have these smaller companies start up. The big thing you want to look for is star ratings. Just like everybody else, 5 stars is the best rating out there. There are very few 5-star rated companies, only a handful. So once you get to a 4, 4 is like doing amazing. 5 is obviously the greatest, but amazing is 4. 3, 3.5 is your average. The way they rate them is, number one, what is the customer service for the patient? What is the customer service for doctors and hospitals? And what is the customer service with the brokers or agents? It's very important. Just like anything else, where you go, they want to make sure that you know how they're being rated. So keep your star ratings. It's very important. Um, Another thing about Medicare is they protect our seniors. Okay, we have to jump through a lot of hoops to get this process done with our clients, and they're very highly protected. I'll give you an example. A lot of this business is done over the phone. Okay, I can write you up over the phone, but those calls need to be recorded, and we need to store those for 10 years. So that's how you're protected, to make sure they're not just writing you up without any concern. I'll give you the biggest complaint that people get is, you tell me my primary doctor is Dr. Z. And I'm saying, okay, yeah, no problem. Dr. C, make sure he's in your you know, in the uh, group that I put you. I'll make sure Dr. Z's there. And when you get your packet and you get ready, Dr. Z is not part of that plan. So now you're very upset. I know I would be very upset. So guys, people do it just to write you up. So you need to make sure you get somebody who really cares and cares about you and what you're doing. But we're very, very strictly mandated to make sure that we record calls, that we give you the information and give you 2 days to think and make sure before we write you up. There's a lot of things in place to make sure that you're giving the right information and that you're happy with what you have. The last thing I want to cover is PACE. And PACE is a program that's also supplemented through Medicare. And PACE is programs for like the elderly, the people that are 80, 85, they live alone, they don't have family to help them, they can't cook, they can't clean, they need help. These PACE programs are all inclusive. It's kind of like the vacation places, right? Everything's included. Well, same thing with this. It's all included. They will pick you up, take you, they feed you breakfast and lunch, depending on your condition, 2 to 3 days a week. They take care of your medication. They take care of everything for you. It's very important now. And the only reason I bring it up more than for the elderly, because people who have family members that have dementia or have Alzheimer's, and they're very, very difficult to handle. And I tell you firsthand because my father-in-law, before he passed, had dementia. And it was a difficult situation for us. And luckily, it was myself and my wife. there to help him during this period. And if we knew about this PACE program, I think we would have signed him up for it because they could have taken him, they could have bathed him, they could have, kept him occupied and given us a break, and these programs are out there. So if you know of anybody and again, it's not a negative thing because some people love it. They get to be picked up, taken over, they play bingo, they do crafts. It's all inclusive. So there's programs out there if you're in a situation or if your family members or friends or neighbors that live alone and need help. This is a perfect program. More than anything, the people that have family members that have Alzheimer's or dementia, this would be a great program for them. So just keep that in mind. Um, so what do you need? What do you need to know? Okay. Again, your max out of pocket. The max out of pocket is just telling you that you would have to pay whatever it is, whether it's 2,000, 1,000, out from whatever your bills are. That's your max out of pocket. And that includes, like, for example, your copays to your doctor's office, your copays to the specialist. If you go to emergency and you're not uh, taken into the hospital, it's, let's say, $75. Those are all that add up to your max out of pocket. So whether it's the average of 1,000 to 2,500, or if depending on the plan you pick out, it can be as high as 35 to $8,000. That's what you need to know when you're checking for these programs. Again, dental, and if you have dentures, there's some dental programs out there that only offer you $1,000, and there's some that offer you up to 4,000. Vision, again, there's some that give it to you every 2 years, and there's some that give it to you every year. So keep that in mind. And how much are you going to give you? $100 up to $300. There's some that even give you a little more than 300. So again, vision. Hearing, again, they can give you 300 up to $1,500, and even some that'll give you more, but that's your average. The over the counter, which is the biggest thing right now. How much are they offering you? Are they offering you $50, $85, $100? So keep that in mind. Transportation. If you don't need transportation, then hey, if there's only 20 trips, you're good. But if you're going to rely on a transportation to take you to your doctors, to your specialists, anything that has to do with medical, there's some programs out there have up to 80 trips. So keep that in mind. And again, if you're older, or even if you're not older, if you have knee issues or any kind of health issues and you need that medical alert, hey, those things are expensive. And if these programs, if you know you need it, and make sure you get a program that has that medical alert. And like I said, gym, we all try to stay healthy. If they have the gym membership, look for that for yourself. So find out what all the other things are that they offer outside of these basic ones now. So again, just to fill in the gaps on the original Medicare, we're back to keeping original Medicare. We kind of said about Part A, it's a hospital, and that's inpatient. Okay. It also covers your skilled nursing and your senior, there's some home health care, and then there's hospice. And again, there is no premium. Again, we are on original Medicare. The things you need to look out for on original Medicare is your deductible of $1,632. And like I said, that's for a 60-day benefit period. So keep that in mind. The reason we have everything else up here so you can know there's other expenses, and all of these expenses are going to be covered if you get the Medigap insurance will be covered. The $408 for the day 61 through 90. There's $816 daily limits on reserve days, and for skilled nursing, it's $0 for day 1 through 20, and then after day 20 to day 100, it's $204. So this is the total of what you're going to be paying if you stay with the original Medicare. And again, that's why we highly recommend you to get the Medigap, because Medigap will cover every single one of those expenses that you'll have with the original Medicare. And the Part B, again, we covered medical, being your doctors, your outpatient, any outpatient surgeries, private care, ambulance, non-self administered medications, durable medical equipment, if you need walkers or wheelchairs, anything like that. Just keep in mind that there is a $174 deductible. There's no way to get around that, no matter what plan you go to. And again, keep in mind that you have the annual Part B deductible of $240. And then it's co-insurance after that. So keep that in mind. Again, we talked about the co-insurance of the 80/20 and no out-of-pocket max limits. So again, you can rack up a big bill if you have a really bad year. And there is no limit on what your portion is if you do not get that Medigap insurance. Highly recommend it. So Medicare supplement, we covered it already, but again, the Medigap is the same thing. Medicare supplement and Medigap is the same thing. It's private insurance, and it's going to cover anything that Part A and Part B does not cover. Your average premium is about $150, and don't forget that will not pay, and you will have to continue to pay your Part B premium. Part D, biggest thing. Again, it's private insurance. Your premium average is $20 to $50. There's a formulary that has tiers involved. The good thing is you don't have to worry about any of that because your agents, whoever you choose, will take care and look and make sure that your medication that you're taking is covered. There is co-pays on some tiers. From 1 to 2 is normally 0, but it can run up to $10 depending on what company you go with. Tiers 3 and 4, your average is $30 to about $150 on your medication. But here's the great thing, like I said, it's max out of pocket, $2,000, and they're going to count the full price of that medication, not just the portion you're paying. So believe me, if you take a lot of medication, it'll run up to the 2,000 and you no longer have to pay anything else after that. The Part C, we talked about it. Again, it gets confusing because Part C is the same thing as Medicare Advantage. It's the same thing as Medicare Advantage prescription drugs or MAPD. Private insurance, you're giving up your original Medicare. You can either do the HMO or the PPO. And again, the HMO is as little as 0 premiums. Your max out of pocket on that HMO is anywhere between $1,000 to $2,500. If you decide to go with the PPO, again, there is a premium, is about $25 to $100 depending on the company you choose. Your average max out of pocket is $35 to $8,000. And again, your Part D prescription normally is $0. And your max out of pocket on your Part D is the $2,000. Again, these programs include the dental, the vision, hearing, over the counter, and like I said, many more. Your gym, your medical alert, your Fitbits, etc. The expenses are your co-pays that you have to pay, your co-insurance, and Part B premium of the $174.70, and your max out of pocket. So guys, that's pretty much what it all comes down to. It's a little confusing. Hopefully that made it a little more understanding. You can understand a little more. I can open this up to questions. And again, just questions regarding what we went over. If it's personal about your needs or your health or anything like that, please either give me a call, text me, or email me so we don't have to worry about HIPAA here. So any questions, feel free to ask.
Thank you, Mike. We do have a couple of questions in the chat box. Craig asks, are there Medicare supplemental plans for retired veterans who have Medicare and TRICARE for life that cover prescriptions, vision, dental, hearing, etc.?
There is. That's why there's Medicare Advantage, and then there's Medicare Advantage prescription drugs. Normally, the veterans have their prescriptions covered through the VA, And that's why they weren't doing the Medicare Advantage programs, because why pay for something that you already get for free? So most of the veterans would go with just the Medicare Advantage to get all the other things that we just talked about. But they normally stay away from the Part D because, again, the veterans get it through their veterans' rights with their Medicare, with their medical. But you can sign up for the Medicare Advantage with the prescription drugs. It's just the veterans that do it is because they don't want to hassle with the VA, because we all hear of all the nightmares that goes on with VA. And but I understand that most of the veterans don't have problems with the drug part of the VA. Is just getting in there and getting appointments and so on and so forth. So a lot of the veterans will do the Medicare Advantage without their drugs, but you have the option of doing either or.
Thanks, Mike.
Mhm.
And then Laura asks, how do you get the OTC money?
Okay, it's part. So let's say you pick plan. I stay away from the. Let's say you pick Plan N with me. Plan N is one of these Advantage plans, the Medicare Advantage with prescription drugs. That package, let's say this package includes 85 over the counter, $85. They give you a Visa card as part of your package, your welcome package. And that Visa card you could use at your CVS, at Walgreens, at Walmart, any of these companies, and you can go use that $85 for your aspirin or your cough drops or your flu medicine or anything that you buy over the counter.
One more question in the chat. Do you know about Idaho Medicaid program that pays for Medicare premiums, I'm guessing?
Yes, yes. And most states all offer Medicaid. If you qualify for that, it will pay for all your premiums, including the Part D drugs. So it will cover everything. It even covers your Part B deductible. So yes, if you have Medicaid, or in California is the only one who's a little different from everybody else, it's Medi-Cal. They will pick up all your premiums and all your other things that are not covered.
And William, yes, the recording will be available on our YouTube channel probably tomorrow or the next day. And Craig says the H company is on TV right now.
Okay.
There, but if anyone wants to unmute and just ask your question verbally, please feel free to, if you have anything. I don't see any. Okay. Well,
Mandy, that's a compliment, Mandy. If no one
yeah.
else is asking questions, that means I did a good job.
And that was
But
a
again,
lot of info.
yeah, it was. Again, guys, my phone number is there. If you prefer to text me. If not, give me a call, or I know a lot of people prefer email. Feel free. Please send me the questions. I'm more than happy to go over with you and give you personal information about your situation, and probably would be the best thing for you to do with no obligation. So again, I would love to earn your business, but you're not obligated to do anything, but feel free. You guys are my Men at Heart family, and I'm more than happy to help you out. And if not you, if you have family or friends or people turning 64, say, hey, I know this great guy, Mike. He'll be more than happy to help you guys out.
Thanks, Mike. We really appreciate you offering
Okay.
your free time and knowledge. Have
You
a
got it, Wendy.
great evening,
Anytime.
everyone.
You guys too. Thank you very much for joining, guys.
Thanks. Bye.
Bye.